In Western Sydney, more than 50 community groups have formed a coalition to fight the federal government's income management trial. Bankstown is one of 5 locations nationally chosen for the 5-year test. It means for some people between 50 and 70% of welfare payments will be set aside to spend on essential items such as food and clothing. But the Arab Council and Indigenous elders say the policy is discriminatory. Amy Bainbridge reports, and our Aboriginal and Torres Strait Islander viewers are advised that this story may contain images of people who have died.
This is the heart of Bankstown, 20 kilometres west of Sydney's central business district. It's considered one of the most disadvantaged areas in New South Wales, with high youth unemployment and many people on long-term welfare payments.
You know, you've got a lot of unemployed people around, and a lot of the young ones don't want to work at all. You know what I mean?
In terms of disadvantages, like everywhere else, there are pockets of disadvantages in Bankstown. There are also great wealth in Bankstown if you go to different areas. So there is high unemployment levels, and particularly among the young people.
Bankstown, along with Rockhampton and Logan in Queensland, Playford in South Australia and Greater Shepparton in Victoria, have been earmarked for a 5-year trial of income management.
These are all areas where we have high unemployment, large numbers of people on income support. We want to make sure that they're given this extra tool of income management to help them manage their money.
Income management was pioneered for the Northern Territory intervention in 2007, and a modified version was rolled out soon after in Perth and the Kimberley region of Western Australia. For the 5 new areas, parents who are referred by child protection authorities and people assessed by Centrelink as being financially vulnerable will go on the scheme, or people can volunteer to take part. Income management puts between 50 and 70% of welfare payments onto a basics card to buy priority items like food and clothing at approved stores.
Not only have we found from the authorities that it's useful, but people themselves, those who are on both the child protection, income management, and those who have voluntarily decided to go on income management, have said they found it useful for themselves, but they've also said that they would recommend it to their friends.
A report on the WA experience is based on interviews with less than 10% of the 905 people in WA on income management, as well as staff from government agencies and community groups. Some Indigenous communities in the Kimberley reported less drinking, gambling and violence since the introduction of income management. But the WA Council of Social Service says the research is inconclusive.
So what we really need to see is improved evaluation that actually looks at some objective indicators of wellbeing of children and whether or not it has actually increased the benefits for children from a health wellbeing perspective, and also some objective evidence about what kinds of spending we're actually seeing happening with the basics card.
Even hard statistics may not persuade these local leaders in Bankstown that income management is a good thing.
It is basically an abuse of people's civil rights. It's their right to choose where they want to shop, where they want to spend their money. For any government to interfere in that, how people live their lives is harsh, it's draconian, it's very paternalistic.
I think that long term we need to address the underlying issues. We need to provide interventative packages, processes and support for them, and what that means is investment in community organisations and investment in other forms of support for people with problems.
We are providing additional funding for additional services, so there's more money for financial counselling, for example. There's more money for communities for children. In fact, I launched that myself in Bankstown. That's additional support for families with children up to the age of 12 to make sure that families who might be having difficulty managing do get advice early.
Margaret
Paddy Gibson has spent years researching the effects of the intervention in the Northern Territory. He says income management is not a silver bullet solution to complex social problems.
Well, I think it's very, very easy to scapegoat people who are in hard social situation for their own problems rather than looking at the underlying causes of those issues. So, in the Northern Territory, it's just Aboriginal people. Well, it certainly was under the first intervention. Aboriginal people were just a net was thrown over them. You're dysfunctional, you can't look after money, you can't look after your family, you're an alcoholic, and we're just going to punish you, we're going to control you. Down here in Bankstown, it's a little bit more sophisticated than that, you could say. It's people with mental health issues that'll be targeted, people that are having trouble, with their money, people that might have problems with drugs or alcohol that are coming into contact with the child protection or juvenile justice systems.
Treat us with respect. Don't take our self-worth and our pride away and our integrity and our dignity. And help people who have a problem. Of course, not everybody is bright and pays their rent, electricity and everything on time, and neither does anybody else that is working. That's all we want, is to have half a go. A fair go in Australia. Isn't that what Australia is all about?
Of course I understand people's views, but my primary concern is to make sure that when we're talking about the protection of children's interests, if they're in danger of being removed from their parents because of neglect, and we could put in place income management rather than have that child removed because of evidence of neglect, I would have thought we'd all prefer to see the child able to stay at home with their parents if we can deal with managing that parent's money.
The scheme will be introduced on July the 1st. Amy Bainbridge, Lateline.